nutrition strategic plan. Yeah, 2018. It is no more. Okay, so this is preventive, those that will build up our bodies and provide energy, and that is a variety of them all. We have 10 figures we have coming, and this is predisposing them to lifestyle diseases.
It is an honor for me to address you on a matter that is very close to my heart. The health of our children is very, very important. We are here because we care about your children, and that's why we have taken our time from our other schedules to be with you here today. When children are healthy and fit, they will thrive and enjoy life. Children can only thrive when they have good nutrition and good foundation. We are here today to mark this important day called Malezi Bora. Malezi Bora is a Swahili word which means good upbringing. The campaign period is also called Malezi Bora Week. Malezi Bora campaign started way back in 2007, and it was initiated by the Ministry of Public Health. You've seen the representation from the national government, both administration and the department of the ministry. And they did this in consultation with UNICEF. The theme of this year's Malezi Bora Week is Afya Mashinani, Ustawi wa Jamii, for the attainment of universal health coverage. This is an initiative implemented nationally as a strategy to reverse the worsening trend in the maternal and child health indicators. It is a special activity carried out twice every year, in May and in October, to advocate for better health and nutrition for mothers and children. Kenya faces a triple burden of malnutrition, with acute food shortages leading to acute or chronic malnutrition. Nationally, the current rate is 18%, and in Migori we are 15%. That means we are not doing well at all. We have increasing rates of overweight because of the foods we eat, and this end up exposing us to lifestyle diseases. Today's campaign, as we have already mentioned, focuses on giving vitamin A to all children aged between 6 months and under 5 years to boost their immunity. We are also providing deworming tablets to all the children between months 12, that is 1 year, to 59 months. All the children are also being screened. Children under 15 months are being screened to ascertain whether they are malnourished or they are okay. And any identified cases are being referred for treatment. We are considering these ages, which mainly focus on the first 1,000 days of a child's life, which is between the first day of conception of the child up to his second or her second birthday. It is a unique period or opportunity when the foundations for optimum health and development across the lifespan are established. Strengthening health system by identifying bottlenecks, as our department is doing under Ochilo's government, prioritizing actions and building capacities at primary care and community levels, which is being done by our people here, improving linkages with early childhood development centers, building capacities for ECD teachers for growth monitoring, having improved hygiene, early identification of malnutrition and referrals to care, building capacities of the frontline community health promoters who are here with us today, and also ensuring that we complete the immunizations, all contribute towards optimum foundation for children. Migori has in the last 2 years raised the coverage of Malezi Bora, initiating from 50% to 96%. This is the second celebration that we are having. The first one was in Suna East. So you must consider yourself very, Suna I think because I come from Suna, we favor Suna. This has been achieved through amplified knowledge and awareness on maternal, newborn and child care, child health, and intense sustainable advocacy and social mobilization. We thank our CHWs for doing that. Community involvement in healthcare provision, Intensified support, supervision, and outreach services have been instrumental in achieving this. To achieve the above, the 96%, I wish to recognize the efforts from our national government, represented here, our county government, represented by the minister. We also have Red Cross Society, Western Kenya Water Project, UNICEF, Luala Community, KMET, Blue Cross, Compassion, USAID, PATH, Triple Effect Kenya, KFADO, Oasis Doctors, Life Care, Child Fund, Breakthrough Action, Lake Region Development Program, that is LREP, and any that I may not have mentioned. We are really truly grateful, and we hope that you will continue helping us because our figures are still not as good as expected. In a special way, I also wish to thank His Excellency the Governor, Dr. Ochilo Ayako, for the efforts he has shown so far and has put in place to ensure that we build a strong foundation for our children. We know Ochilo's government has established new ECD classes. They have done training for the nutritionists. They have developed multi-sectoral nutrition action plans, that is for 2022 to 2028. And we are also doing baby-friendly community initiatives. I'm aware that we are doing markets where we'll have creches and we'll have lactation spaces for our children so that our children can, we are sure that they can breastfeed for the first 6 months. In conclusion, to my fellow First Ladies, I know one has left, I take this opportunity to thank you all on behalf of our Governor for finding time to come and celebrate this important day in our calendar. To the Ministry of Health, Division of Nutrition, thank you too for gracing the occasion. I thank the organizing committee. I know for us to be here, it has taken a lot of work. You have worked around the clock to achieve this. Health workers at different operational levels, thank you for your continued good work. Without forgetting our able partners who have been with us throughout the planning period. And last but not least, to the communities present.
Tumekuwa hapa siku tatu kushuhudia various projects ya huyu mama wenu ambao amefanya kazi mzuri sana. We all look to her and we are learning a lot in Migori, and we are very happy to have been here for the last 3 days. Unfortunately, I have to leave. As you know, Kenya is very far. There are other places we have to go. So I just want to say congratulations to the health department and all our partners, because many of the partners represented here are also partners for Sierra County. On the launch of the MHM policy, I think this is a step that you have pioneered, and we will definitely follow in your footsteps. So thank you very much.
Akwayo ni take advantage mar services mama ni okelonu. Mama ni oherou. To aneno ka en jakinda, enie gweng ka gweng, enie every department, korka health, korka education, korka development, fistula be ang'eno setimo. So en mama motegno, mochiure ni mondo okony jopiny. So take advantage of the services. Awinjo nitie Beyond Zero, and korka health omokona ahinya nikech ang'eyo ni health a foundation.
To an aonge any kiti ma location nitiere mabiro ni mar jowega. An anyalo mana kwayo from the office muneno mbele na kar kagi. Omiyo nada kwayo unier na uro chilo mondo okoloko biblia kar ka ber koso ber. Mogik dhiang' bende ng'ene ki dher chak minyiedho. Dichwad dhiang' tinyiedho yud chak. Sani dhero mar chak mar kaunti ma Migori en Ochilo Ayako. Dher chak ikwayo tioya oya sami nyiedho yuen openda inyiedho dhiang'. openda tinyiedho chak. Okoro kaka watime, eno kwayo nitiere gima nyocha otimore Urithi sub-county. One, as the elected leaders of Migori County, we condemn it in the strongest term possible. Siasa maoda chako Migori machoni kabisa, odhidi rail the development agenda of the late leaders mane waseyiero gisani.